Welcome to this week's edition of Hematology and Blood Cancer Updates, covering the latest breakthroughs, brought to you by LucidQuest. In Japan, Blenrep combinations have been approved for relapsed or refractory multiple myeloma based on the DREAM7 and DREAM8 trials. These studies demonstrated significant improvements in progression-free and overall survival compared to standard treatments. Importantly, the regimen showed a low treatment discontinuation rate and no confirmed cases of permanent bilateral vision loss. In the United States, the FDA's Oncologic Drugs Advisory Committee voted 6-2 in support of approving Darzalex Faspro for high-risk smoldering multiple myeloma. Backed by data from the Aquila study, this could become the first approved therapy in this early-stage population, signaling a shift from passive observation to active intervention. Regeneron's bispecific antibody linvoseltamab, in combination with proteasome inhibitors, has shown early signs of strong efficacy. In the carfilzomib arm, overall response rate was 90%, with a 76% complete response rate. The bortezomib arm recorded 85% overall response and 50% complete response. The safety profile remained consistent with known T-cell engager-related toxicities. PeproMene's BAFF-R targeting CAR-T therapy, PMBCT01, achieved a 100% complete response rate in 7 heavily pretreated patients with relapsed or refractory follicular lymphoma. No cytokine release syndrome or neurotoxicity was observed, and the company is now planning expansion into mantle cell lymphoma and diffuse large B-cell lymphoma. In China, InnoCare's Minjuvi was approved for relapsed or refractory diffuse large B-cell lymphoma. It is the first CD19 targeted antibody to receive this approval in China. The drug demonstrated strong duration of response, consistent with the global L-MIND trial, and is now accessible through early access programs in BOO. Roche's bispecific antibody Columvi, when combined with Gemox, achieved a 41% improvement in overall survival compared to Argemox in the STARGLO trial. This marks the first bispecific combination to show a statistically significant survival advantage in transplant-ineligible DLBCL. It is now recommended as an NCCN Category 1 regimen. 2-year follow-up from the STARGLO trial confirmed the durability of this benefit. Median overall survival had not yet been reached in the Columvi combination arm, compared to 13.5 months for Argemox. Additionally, 89% of patients who achieved a complete response were alive 1 year post-treatment, and the regimen demonstrated a 59% reduction in disease progression. In Europe, the CHMP has issued a positive opinion for Autoluce's Obicel in adult patients with relapsed or refractory B-cell acute lymphoblastic leukemia. The FELIX trial reported a 76.6% complete response or complete response with incomplete hematologic recovery rate, with a median response duration of 21.2 months. The therapy showed low rates of severe cytokine release syndrome at 2.4% and minimal neurotoxicity. A decision from the European Commission is expected within 2 months. In Taiwan, Piasky has become the first subcutaneous treatment approved for paroxysmal nocturnal hemoglobinuria. Administered once every 4 weeks using recycling antibody technology, Piasky proved non-inferior to eculizumab in the Commodore 2 trial and remained effective even in patients with C5 mutations. Novel Med's investigational therapy, ruxoprubart, delivered best-in-class efficacy in its Phase 2 trial for PNH. It met all primary endpoints, including transfusion avoidance, hemoglobin increases greater than 1.6 grams per deciliter, and LDH reduction. No adverse events were reported, and the therapy is administered once weekly via subcutaneous injection. Orphan drug and breakthrough therapy designations are pending. The FDA has approved Bayer's extended half-life factor VIII therapy, Gv for children aged 7 to 11 years with Hemophilia A. The Alpha Protect and Protect Kids trials demonstrated reduced bleeding frequency and strong prophylactic efficacy. Dosing options include twice weekly or every 5 days. In the United Kingdom, NICE has approved marstacimab for severe hemophilia B. This is the first once-weekly subcutaneous therapy for the condition. By targeting tissue factor pathway inhibitor, it enhances clot formation and reduces bleeding. The approval is based on improved patient outcomes and quality of life compared to more frequent intravenous infusions. Stay ahead in hematology and blood cancer research. Like, share, and subscribe for weekly updates. Visit lqventures.com or email us at info@lqventures.com for expert healthcare consulting. See you next time!